Hi there. Welcome to our Facebook Live today. I'm Diane Ray, co-founder of MindBodySpirit.fm, and we're just getting a few minutes of a late start here. And if you know, you know, I think we're going into some kind of, Mercury retrograde with tech issues, but we are here and we're ready to go. And I'm excited to welcome our podcaster today because I think you're going to learn a lot. Now, if you've ever known someone who's suffered from chronic back pain, chronic pain, or maybe you yourself, I mean, personally, I've had this experience. My husband suffered from really debilitating chronic back pain, and he was able to heal. So I know that you can heal. I know that this can happen. So today we're going to be talking to an expert, Dr. David Hanscom, and his podcast, Back in Control, is the go-to podcast for people that want to find out how to eliminate chronic pain and reclaim their lives. And this is a big issue. I mean, I was looking at some of these stats, like over 50 million Americans experience chronic pain. So this is a huge problem. And Dr. Hanscom is going to reveal his secrets here that he shares on his podcast. So welcome. I'm glad you could join us today for this Facebook Live.
Hi, Diane. Thank you very, very much. So you guys have been great to work with.
Well, I'm excited to talk with you about this because, like I said, I know this is a big problem. I've seen it personally. I know a lot of people that are suffering from back pain. They don't know what to do. They kind of throw medication at it. People are afraid of surgery. The implications of that. I mean, I've always heard that that's kind of a last resort, that you should wait until you've gone through everything. So let's get just a little bit of history on your end. I know you've been doing this for a long time. And how long have you been working with people on this, on managing their chronic pain?
Well, really 35 years. I mean, even when I started as a surgeon, I was not totally sold on surgery. But when I joined Seattle Group, we were doing 9 times the rate of spine surgery as anybody else in the country for back pain. And then I found out the success rate was about 22%. And I just stopped. So in the meantime, I went through 13 years of chronic pain myself, and I was on my heels, but I still was trying to help people. But I didn't really figure out what was going on until 2003 when I came out of it somewhat accidentally. But in my worst part of my ordeal, I had 17 different symptoms. I had migraines, my ears were ringing, my stomach was a mess, my feet were burning. And so what's happened since I've talked to you last is not really about chronic pain, it's about what we call threat physiology. And what's evolved the last 2 years, it turned out that the mental pain, the chronic mental pain, is a much bigger problem than the physical pain. Because with physical pain, there's a withdrawal response. With mental pain, there's no withdrawal response. In the laboratory, they've shown that people tolerate mental pain quite a bit less than they do back pain. So the numbers are really stunning because 95% of people have what we call unwanted thoughts, the self-critical voice. And for about 70% of people, they're somewhat disruptive. And for about 5% of the people, they're really disruptive. So anyway, that's what's evolved the last couple of years. It's still, let me say one thing, so I link these two together. I know you talked to me about back pain, but back pain is just one of about 50 symptoms.
Right.
And so what's happened is that the principles we use to treat the chronic back pain also apply to the mental pain.
Well, that just seemed most common to me. Like everybody seems to complain about their backs.
Right.
So that's why I mentioned chronic back pain. And that's what my husband was dealing with, and just the horrible pain that he went in. And you dealt with 13 years of chronic pain. But would you say you're able to, is cure a word that we could use? I mean, would you feel comfortable saying that?
Absolutely. And I don't know who's going to respond. I have one gentleman who had 29 surgeries in 20 years, and he went to pain-free about 10 years ago. I've had endless number of people who have been pain 5, 10, 15, 20 years, multiple surgeries. And what happens is that the principles have changed a bit since I taught you also, in that we look at self-help processes as trying to get rid of the pain, but it actually reinforces the pain. So what we actually have learned to do is that we learn to regulate your body's chemistry from fight or flight to safety. In fight or flight that's sustained, i.e. chronic stress, the body breaks down. In the safety physiology, where your body regenerates and heals, it's magical what the body can do to heal. So yes, all 17 of my symptoms are gone. And if I get triggered or get stressed out, that's a body chemistry reaction, some of my symptoms come back.
So you're saying the mind-body connection, that's a real thing.
Well, I'm going to reverse that a little bit also, because I also learned this a few weeks ago. This actually body mind. So if you see somebody that's dangerous across the street or something happening that's exciting, your body actually reacts first, and the thoughts come about 1 to 10 seconds later. So we keep thinking it's the mind running this game, and it's actually your body staying alive. And you look at my cat. My cat doesn't have a neocortex. She doesn't have language, but she stays alive just fine. So what happens, we have these survival reactions that protect us. They're unpleasant. We take them personally, which is a huge problem. So we have these untoward survival reactions that we use all this cognitive energy to try to rationalize that I'm not that person. But the reality is with survival, it is survival. It's dog eat dog, and they're really unpleasant sensations. But it's the biggest problem we have with the human condition is that we take these survival reactions personally. There's a lot of language in our heads to try to rationalize, oh, we're not really that person. Well, your survival reactions are a gift to keeping you alive.
So when people come to you with, whatever the issue is, back pain, chronic pain, whatever form, how do you start working with them to experience some relief? What would you like a new person who's just hearing this now to know what they can do?
Well, I'd say a person I met about 5 weeks ago who had been recommended a major spine surgery, again, on a normally aging spine. And it turned out as I talked to him, he was suicidally depressed, really, really depressed, right on the edge. And the data has shown for 50 years that you just don't do surgery on somebody who's depressed because the outcomes are horrible. So the biggest factor is I say, look, don't believe anything I say. This is not about believing David Hanscom. It's not about believing in a process. It's just learning the skill to regulate your body's chemistry from threat to safety. And so the first thing is education, just understanding the problem, not all of it, just learning to work with it. Then the focus is on learning skills. And I have a course I put together called the DOC Journey, Direct Your Own Care Journey, which is very self-directed. You don't need a pain clinic. You don't need big treatment plans. But I always do make sure medical conditions are covered. So he started this about 5 weeks ago, and I did not think he was going to engage. So the number one factor predicting success is simply engaging and doing the work. Not about generating belief. And see what you're doing, you're connecting to what is. As you connect to your survival reactions, which includes skepticism, when you connect to your life in general, positive and negative, your body starts to heal itself. So the first 2 weeks were sort of nothing happening, but he's sort of intrigued. And I talked to him yesterday, and his depression's almost gone. He hasn't been that way for years. His mood's much improved. His pain is a little bit better, but it's different. He's not upset about it anymore. And that is the first thing that happens with physical pain is that you change your relationship to it. So you're here, the pain's there. It's actually protecting you, and you don't have to like it. It's not about conquering the pain. But the way the healing happens is you learn to live with your pain, which includes survival physiology. And then on the other hand, you nurture joy. So you actually stimulate your brain to change in the direction that you want. As you stimulate this new nervous system, the old nervous system starts to fade away.
So what would be some of the techniques or a tool that you can share when you're working with someone? So if I came to you, would you say, here's maybe some meditation techniques, or because it seems like, how can you tell someone to think joy or to feel joy, especially if someone's clinically depressed? You can't just say, well, cheer up.
Well, no, and that's a disaster, by the way. So I'm writing this book on repetitive unwanted thoughts, and positive thinking is a complete disaster. Affirmations are a disaster because you're actually reinforcing threat physiology. So it's two separate skill sets. One of them is you learn to live with your stress physiology. You learn to regulate it. And on the other hand, when you can, you nurture joy. They're two separate skill sets, but they're linked. You can't nurture joy when you're angry. Not going to happen. So the first thing, if you came to see me, is look, I have a book, Back in Control, A Surgeon's Realm about chronic pain. And it's the same thing I did in practice. I said, look, here's your homework. Just understand the problem to some degree. You're not going to understand it the first time through. Then if you're in my office, I say, look, I want you to do some really simple things. And one of them, as you well know, is called expressive writing. I don't try to explain the whole situation to them. But the thing is, your thoughts run crazy and you can't control them. But what you do, you just do a free flow writing, write down anything you want to write. instantly tear it up. And what you're doing, you're separating from your thoughts. And you're not catharsing, you're not trying to solve them. And the reason why you tear them up is to, first of all, not analyze them, because that reinforces them, and also to write with absolute freedom. So honestly, the darker the thoughts and deeper the emotions you can get on paper, the more effective the process. So expressive writing is one. The second one is called active meditation. So if you're really fired up and whatever, you just can sort of drop your shoulders. You do it right now. Just take a deep breath, relax, and your brain goes to a different sensation besides pain. The third thing by far and away is sleep. You got to sleep. And usually I think the first part of the process, it takes medications. I'm at a distinct disadvantage right now because I was in practice. I would hit people hard with medications to get them to sleep. So unless you're sleeping, nothing's really going to happen. It just is that powerful a process. And the other process that's equally as effective as or important as expressive writing is never discussing your pain, ever. So I said, look, you're in my office, Diane. When you walk out the door, I want you to never talk about your medical care. I don't want you to discuss your pain. I don't want you to complain, give criticism, give advice, or gossip. Done. It's actually hard. It's actually
It
one of
is
the
hard.
hardest things to do. But the problem is we have a model called dynamic healing where you have your input or your stresses. That's the input. And then like every living creature, you have a nervous system that has all these sensors that process the input. Then your brain sends out signals to your body of either fight or flight or safety. So if you're complaining, etc., and negativity, you're going to be in threat physiology.
That's so
And
interesting.
it's turned out to be a huge factor. And I can't tell you how hard it is to get to people to actually stop complaining.
Well, I'm just thinking of a group of women that I just spent a weekend with. And as you get to a certain age, it seems like the main topic of conversation is your latest, your latest surgery, procedure, test, or all of that. So
Right.
you really do have to consciously make that choice that you're not going to revel in it, talk about it, share it, that kind of thing.
Right. In fact, one of the biggest negative factors for healing from chronic pain is belonging to a pain support group. Because talking about putting your brain where you don't want it to go, you're right there in the pain, you're interacting, then you're mixing that group session with what's called oxytocin. So the pain actually gets mixed with pleasure chemicals, and discussing your pain, especially in a group, is actually a disaster. There's a very negative prognosis for fibromyalgia by belonging to a fibromyalgia support group.
Right. And that seems kind of counterintuitive, but it makes total sense. And then there are those people that you probably have to separate yourself from that enjoy doing that. And then also maybe enjoy hearing about other people's discomfort.
Absolutely. I mean, absolutely. The hardest problem I had, I've been through a few surgeries myself, is that, I had a bad knee, so I was limping, and I had endless people tell me, get surgery, how's your knee, do this, and this. And it gets tiring.
Mhm.
And it's not that much fun.
Right.
And gossip is another one that we don't understand how powerful gossip is, but it really is not the right thing to do, especially malicious gossip. And it's easy to do. And I don't know how much time we have. There's a whole different topic of these repetitive, unwanted thoughts that's really, really critical to discuss. Do you want to go there for a second, or we should stick on this one?
Yeah, well, you could share a little bit about that because I think a lot of people suffer from that endless loop that
Right.
seems to play in your head of unwanted, repetitive thoughts.
So what happens when you're angry and frustrated, your body's chemistry goes into fight or flight. So the blood supply to your thinking brain drops way down. It's actually not even working. And that's why people that are authoritarian actually create chaos first, no matter what they're doing, start a war or whatever. And then what happens, people are upset, they're anxious, and they're reacting. So the person in charge has control. So what happens is that we have a lot of stress physiology, and you have to have your thinking brain working to make positive choices. Otherwise, you're only reacting. So healing occurs with creativity, but you have to get your brain online to get back to creativity first. So going into these repetitive unwanted thoughts, first of all, 96% of people have them. That's a lot of people. And about 70% of us have them at a level that's disturbing. I had them for almost 20 years where I call it extreme intrusive thought patterns, which was really horrible. And of all my pain symptoms, these unpleasant thoughts were the worst part of it. So here's what happens. So when you're in chronic pain, you're envious. You're envious of everybody else that doesn't have pain. They have less pain. They have a better life. They have better families. They have almost, when I was in chronic pain, I was so envious of everybody, I could not even put it into words. Then envy exists anyway. But what envy does, you already have pain physically in your body, then envy actually lights up the pain circuits. So then what happens, how do you get rid of that pain? So what does get rid of the pain is a word called Schadenfreude. Have you heard of this word?
I have.
And so what happens that this is true for everybody. I don't care who you are, is that your brain reacts, it lights up the pleasure circuits. So by experiencing Schadenfreude, you actually experience less pain. And so what happens if you're the person like myself that doesn't have Schadenfreude? I have it. Everybody does. It's a survival reaction. But a lot of repetitive thoughts come out of the fact that you're the person that couldn't have this emotion because I'm too good of a person. So your brain has all this rationalizations and suppression and all sorts of stuff. But the reality is with Schadenfreude, in the wild, if your competition goes down, you have a higher chance of survival. It's a normal survival reaction. There's nothing wrong with it. In fact, you should not suppress it. So if you watch like Ted Lasso, where the good guy wins, bad guy loses eventually, that's Schadenfreude. So when you look around you, it's everywhere. So people have less pain by watching other people suffer. But when it becomes active Schadenfreude, in other words, taking other people down or bullying or intimidating people, that also creates Schadenfreude. I call it active Schadenfreude. And so being judgmental and critical, gossiping, etc., that's active Schadenfreude. That's a problem. So then the final part of this thing is, so you have less pain by actually hurting other people. The problem is it's short-lived, it's addicting, there's no end to it. It obviously doesn't make life better. But then that Schadenfreude gets directed at yourself in the form of a self-critical voice. So we spend all this time trying to reassure ourselves that we're okay. Well, the self-critical voice is universal almost. And we try to do all these things to reassure ourselves that we actually are okay. But remember, those self-critical voices coming from the lower part of the brain that is not subject to rational control. So that's coming from down here. And if you start working up here with cognitive counseling, reassurance, all sorts of stuff, you're actually reinforcing the circuits. Okay. And so it's sort of a disaster.
And what are some ways to, but how do you actively stop those obsessive critical thoughts?
You can't. So what you do, you lower the driving force, which is stress physiology. And again, I'll try to make this short. Your anxiety and anger are just sensations, or just words that humans use for the sensations of fight or flight. So anxiety represents vulnerability. Anger represents solve the problem. And Schadenfreude means problem solved. Let's go have a beer. So they're deep survival reactions that are much stronger than your conscious brain. So with these thought patterns, I use the example of a hornet's nest, where the nest represents your brain, the hornets represent your thoughts. And if somebody shakes the nest, the hornets aren't that happy. So we're out there fighting these thoughts outside the nest, making the hornets even angrier, where the real reason is to stop shaking the nest. In other words, use the tools to calm down your stress response. And so there's a bunch of ways of doing that, which is beyond this discussion. But that's what the doc journey does. It allows you to reach the tools, actually solve your stresses better, calm the nervous system, lower the physiology. And all of them work, all of them are necessary. And one of the problems we get into medicine is that we have our stresses and our coping skills. And if they're overwhelmed, you go into stress physiology, then you have symptoms. In medicine, we're treating only the symptoms. And so we teach people how to process their stress differently, i.e. not discussing your pain is input. With the nervous system, it's diet, sleep, and exercise, and some trauma therapy. With the physiology, you stimulate the vagus nerve. There's humming, all sorts of things of calming tools. And on a given day, you might use 5 or 10 of them, but they become automatic with repetition. So life isn't a straight line, as you well know. So you just learn to go with the flow. Some days are bad days. Some days are good bad days, but you don't stay down. And so you might get triggered for a day or two, then you come back up again. And if you try to stay up all the time, it's impossible, and it wears you out. So the key is learning how to lower stress physiology. And as you lower stress physiology, when these thoughts pop up again, you don't go after the thought, you actually go back after the calming tools.
Okay. And people can find out all this information too if they listen to some of the podcast episodes where you share these calming tools and stress reduction tips and things like that.
Right. But I encourage them to look at this as an overall skill set. So what the doctoring does, it takes you through a sequence where you start at the beginning and layer. And over 3 to 6 months, you start developing the skills. And I've been at this for 20 years. And I mean, the last 6 weeks, I've learned a lot more. So there's no beginning or end point. By the way, I do want to call this at some point the journey to nowhere, because where are we going?
Right.
So the way you really crowd out the thoughts is with awareness connected to the moment you're in right now, and you sort of crowd out the other thoughts. So the only goal is this very second we're in. We intellectually know that, but it's hard to get there.
It is. It's something I work on all the time, or I try to. I even called my own podcast "Be Present" to remind myself to try to be in that moment, because it's difficult to do.
Well, again, that's a learned skill set. Is that the bunch of things you do to allow you to be in the moment? See, again, it's a whole different topic conversation. I guess I would just recommend, look at the Back and Control website. There's something like 700 blogs on it. There's too many. But we have your podcast on there, of course, the Mind, Body, Spirit. And then, Les, Ari, and I have done a lot of stuff. So we have our podcast on there. So intermittently listening to different podcasts is great. But whoever you work with, you got to dig in and really learn the tools to regulate your body's chemistry. And so we have found out that it's called deep learning. By really learning specific tools and implementing them makes a big difference. Sort of random learning actually is sort of counterproductive. And so again, the focus is on the skill set.
And people need to be patient, right? Don't you find a lot of times that everybody wants the quick fix?
Nope, not patient. So that's where positive thinking comes. So there's 3 words I look at as connection. Connect everything. So we don't like anxiety and anger, so we disconnect from it. The second word is awareness. And the third word is persistence. So patience, you're in pain. So we try to be patient. That's sort of a positive thinking mode. So I said, look, it's fine to be impatient. It's expected. But the key word is persistence. And you may be better in a month, maybe 6 months. I've had people a couple of years later all of a sudden pop out of their pain. But it's that repetition and seriousness about getting the skill sets. So yeah, the word is more persistence than it is patience.
Persistence. I like that. And you can be free from chronic pain. It's possible. So
absolutely.
You've got some new episodes coming up. Is that right? Do you have anything new that people can look out for?
Well, I mean, Les and I have not done the Mind, Body, Spirit for a while. We've not given that completely. Right now it's happened. I'm up to my eyeballs writing this new book. I have this horrible deadline, September 11th, and I just got an email from my editor about 10 minutes ago that I start to rewrite the book. I'm going, what?
Get to work.
I've been on a commission for about 2 months trying to get this first draft done, and the second draft's going to be just as hard with really bad deadlines. So, but no, we're still going to be doing different podcasts. We have a lot already up in Mind, Body, Spirit FM. Les, Ari, and I do a lot of work together, and we have a good time. We actually have not been in touch so much the last year, but he's been busy. I've been busy. But yeah, no, we're committed to going forward. But, and I'm excited about this new repetitive unwanted thoughts. I did not realize how prevalent they were. But I talked to a girl today who was formerly a beach volleyball player. She was 5 years disabled. She's now back playing beach volleyball. Anxiety down, pain is gone. She's back to full function, but she still has these repetitive thoughts, the self-critical voice. But once you understand the self-critical voice is automatic, it's like one of those clay pigeon machines at a shooting range. Thoughts are just launching out, and those are down here. And if you try to reassure yourself up here, you must be talking to your refrigerator. So you're actually reinforcing these things. So for me, is a real sigh of relief to realize the self-critical voice is universal. And the more accomplished you are, by the way, the worse it gets. And the mental health world does not look at these as solvable, but what they haven't done, they haven't addressed the physiology. So again, think about the hornet's nest. You got to calm the brain down, not to fight the hornets outside the nest.
No, it makes so much sense.
Yeah, I'm excited about it. I mean, people are getting better. I'm still challenged about some people are really, the key word is persistence. And the more you try to move forward quickly, So by the way, I say, look, don't work at this. It's about 10 to 20 minutes a day at the most. Don't spend more time than that. Because again, if you're spending more time to solve your pain, your attention's on the pain. So you just learn the tools to process the pain as you go. So you might spend 10 or 20 minutes a day learning the tools. You spend the rest of the day practicing them. But if you're really in a hurry to get better, you're actually reinforcing the pain, right?
That sounds true to me. You have so much wisdom to share. I mean, persistence pays. That makes sense.
Right.
And
So it's
people can heal.
connection. Connection is key. We don't like negativity, so we stuff it, right? And that's a huge problem. It actually causes parts of the brain to shrink, causes brain damage. And then awareness is everything. So for instance, you heard David Hanscom, you shouldn't be judgmental or critical. So if you're critical, it's a problem. But if you try not to be critical, it's worse, right? You're suppressing being critical. So this is the key issue with awareness. You watch yourself being critical. You watch yourself trying not to be critical, and then you just go on your way. So it's going on your way on your terms is where the healing occurs.
Well, you have so much wisdom to share, and people can go back and check out all of the past episodes of the Back in Control podcast, and we'll keep our eye out for the new book as well. And also, while you're there on mindbodyspirit.fm, take a look at Dynamic Healing as well with Dr. Les Aria that David had mentioned for some great information on that podcast too. And thank you so much for spending some time with me today. I really appreciate it.
Thank
And
you.
I hope everybody can head over to the site and check it out, mindbodyspirit.fm.
Yeah. And thanks for, having me part of your network. We really enjoyed it. So appreciate it.
Thank you.